Hello, ladies, and welcome to another edition of Medical Today with me, Jared Ratnam. Of course, this is episode 6, season 3.0, and on today's show, we're joined by Dr. Zulkifli Ismail, a consultant pediatrician and a pediatric cardiologist from KPJ Selangor Specialist Hospital to talk about vaccinations, immunizations, so on and so forth. Of course, on the back of that, there is a conversation happening with regards to vaccination and immunization, whether you should do it or if you should not do it. These are questions being asked at this point. And I guess what we want to try to do is to get some basic facts on it. And with that, we also want to get a better understanding as to what vaccination and immunization is. Dr. Zul, thank you very much for joining us. It's a pleasure to have you in the studios. And where do we begin with this conversation about being objective with regards to where vaccination has taken us and how it has helped in bringing down diseases in the world?
Sure. Yeah. Well, if you look at the history, you find that now we don't see any more cases of smallpox, and that's since the year 1980, because of the smallpox vaccination. It's been a universal vaccination for the whole world. Every country had made, and it was mandatory at that time to get inoculation against smallpox. And now we don't see any more cases of smallpox. Mm-hmm. We used to have polio here, but in 1972, when we had an outbreak in Batu Pahat, we actually had the polio immunization in the whole country, and we have not had a single case since the year 2000. Mm-hmm. And now there are only 3 countries that has got polio, and the World Health Organization is actually trying to control that in these 3 countries. These are Afghanistan, Pakistan, and Nigeria.
Right. And I guess the bigger question is if vaccines are really effective at this point, because in the Western world, people take this so seriously. You've got people who run anti-campaigns, yes. And this is becoming very big because it's sort of gaining traction. But I guess we need to look back at the history of where this all comes from, and how we have what you call diseases or sicknesses which were long gone. They're all coming back now, yes. And the prevalence of these diseases just goes to show how important vaccinations are. Now, are vaccines really effective? That's the question, I guess.
If you look at the effectiveness of vaccines, all you have to do is look at, as I said earlier, smallpox, mm-hmm. and then look at polio, and then look at what has happened in other countries as well with regard to the decrease of measles cases, the decrease of diphtheria cases, and the decrease of whooping cough or pertussis. All these have come down when the first vaccines were introduced for all of these diseases. So because of that now, because of this people who are starting to refuse and also be hesitant about vaccination, now we have a surge of these cases. Let's take this country, just this country alone. Mm-hmm. We've got a surge of cases of measles, a surge of cases of diphtheria with death from the year 2015 onwards. So we used to have maybe about 300, 400 cases, but in 2015 onwards, we had more than 1,000 cases of measles every year. That's a lot for us. So, when we get that, and because now a lot of people are actually saying they don't want to have the MMR vaccine, which is mumps, measles, and rubella, and that has created this scenario where a lot more people are joining in the bandwagon and then refusing to have vaccination. When you have that, in the long term, what will happen is you will have a pool of people that are not vaccinated, and this pool of people will be a source of infection for other children.
Now, when you look at it, though, the problem in Malaysia started in 1990, circa mid-90s, 92, around there. Now, if you look at how it has gained traction, are you having to go out and speak to people, or having to give people awareness campaigns within your clinics?
Yes, the thing is now, this anti-vaccine information isn't new. It's been there from the time that Edward Jenner first gave the first vaccine, smallpox vaccine in 1796, and since then the anti-vaccine movement has been around. It's just that with social media, it's actually now propagated at a rate that is it's really unimaginable. And you can have one post from a negative information about vaccine, and it goes almost worldwide.
Now I guess some of the excuses that's being brought up, or some of the facts that are being brought up by the anti-vaccine campaigns, talk a lot about aluminium in vaccines. They talk about mercury, so on and so forth. What is the what do we know today about vaccines and the strength of mercury and aluminium that's in there?
Yeah, in terms of these substances, there is mercury, there is aluminium in everything. In all of there's even mercury and aluminium in breast milk. There's mercury and aluminium in milk products, and there's more aluminium in milk products anyway than in vaccines. So we know that these things are there, but the amounts are so small in the vaccines that it actually does not cause any problems. It's just there as what we call adjuvants. And mercury is not present in all of the vaccines anyway. It's only present in the influenza vaccines. So it doesn't really, it's not an issue really.
Right. Now with a vaccine, like say the MMR, how long does immunity last after getting a vaccination?
Oh, okay. It depends on the vaccine. So for instance, if you mention MMR, the mumps, measles and rubella vaccine, that immunity, if you've given 2 doses of it, should be lifelong. It's a live vaccine. At the moment, we think it's lifelong. The whooping cough vaccine, pertussis vaccine, that has the immunity will last for anything between 6 and 18 years. So there is a drop for in immunity. Pertussis. So for pertussis, you actually need to have boosters. So there is an adult booster called Tdap, which is tetanus, diphtheria, and pertussis vaccine, which is given to adults. And I think all of us should get 1 dose of that.
Right. If you look at campaigns ongoing in Malaysia, it's very interesting to see that the Rotary Club has started a campaign that we're this close to ending polio. And with campaigns like this, how are you directly or indirectly involved in it as a person who takes this as a very important subject in your area of speciality?
Right. Well, it involves 2 things. One is I have a direct communication with my patients, those who come to see me, and the second thing is I give talks to the public and also to health professionals with regard to vaccination. And I also run a program called Immunized for Life. Immunized for Life is a program that is initiated by the Ministry of Health, but it's run by the Ministry of Health in collaboration with the Malaysian Pediatric Association and the Malaysian Society for Infectious Disease and Chemotherapy. And we actually come out with, we have a social media thing, we have a website at www.ifl.my, and then we have got social media Facebook account, and we actually are now actually teaching staff within the Ministry of Health as well, together with the Ministry of Health, so that they are more able to handle parents who come in with knowledge already obtained from anti-vaccine lobbies. So, there's a lot of information out there. A lot of that information, if you type in vaccination, a lot of the information actually anti-vaccine, the first maybe 20 or 30 sites are actually anti-vaccine sites. So we're trying to put Immunized for Life in there, as well as other sites from the CDC, as well as some Indian sites which are actually pro-vaccination and giving facts. So what we do is we give facts in a form of storytelling, so that it be appealing to the public.
Right. But I guess the other thing would be, if there's a new set of parents coming in with their first child, I guess when they hear from friends or when they hear rumors that, or there will be, your child may be affected with bad reactions, so on and so forth. So when you meet parents to be, or parents or couples having their first child, what do you tell them?
Yeah, I spend quite a bit of time talking to them about breastfeeding and about immunization. What I tell them is we're going to give these vaccines. There are vaccines in combination, so that your child doesn't get so many injections. The child may have a fever at the end of this, but I will give you some paracetamol and just give the child. If the child does not improve, or you see anything that's different, just bring him back to us. We're here all the time in the hospital. So, and I think that's what all healthcare professionals tell their patients, tell the parents, and it's just being available for them in case we are needed.
Right. Now, when it comes to vaccines for a child, can the vaccine weaken a child's immune system?
Yeah, that's what's been said by the anti-vaccine movements. Now, what the vaccine actually does is actually stimulate the immune system. It stimulates the immune system to produce antibodies that are specific to that disease, and then it stimulates the memory cells, so that if ever that same bacteria or that same virus comes back to the body, then that the immune system is reactivated and engulfs the antigen or the bacteria or the virus and kills it. So that's how vaccines work. And because of a lack of understanding of the immune system, they say that you give too many vaccines, there are too many antigens. The body is able to handle so many antigens at one time. There's no issue about it.
So the question of is it safe to get more than one vaccine shouldn't even exist?
It shouldn't even exist. Here in Malaysia, we actually are wary about giving children more than one vaccine per visit. But if you are a child born in America and you go to see your doctor, your pediatrician in America, you would probably get either 2 or 3 injections at one sitting.
Right.
Yeah, one here, one on the thigh. Yeah.
So that's not nice at all. But
exactly.
Having said that, there are various appointments you have to come to in order to get the vaccines done here in Malaysia. We do it, it's always staggered. Now, if you miss an appointment between one and the next, what happens then? We
continue with it. We don't have to start the whole program again.
Right.
So if you've had 2 injections or you get 1 injection before, and you're late by about 3 months or 4 months or even a year,
right,
we just continue with it.
But does that make a difference though?
Well, if the child has gone through that period without any problem, it won't make a difference. The only problem is if within that period when they're waiting for that booster or that third dose, the child gets that infection. That's all.
Right. But I guess the other question that would come up in the mind of a parent or a parent-to-be is, with all the technology we have today, why so many vaccines? Why can't we just roll them all into one and make one vaccine to help with everything?
Yeah, because there's not one bacteria that causes a disease. So there are many viruses and there are many bacteria that causes disease. So that's the reason why we cannot have one for all. It's just like, you can't have something for one particular person. It has to be individualized, and similarly.
Right. But I guess with vaccines there also is another question, which is the question about boosters. Now, why do some vaccines require boosters?
Okay. Before vaccines are introduced, we do what we call immunogenicity studies, and we look at immunogenicity means we measure the antibody to the antigen or to the virus or bacteria. When you look at the first dose, you get a boost of antibodies. Then it flattens, and then you get second booster, and the antibody goes up some more, and then it flattens, and then the third one it goes booster. If you wait another 6 months to a year, you give the fourth booster, then you get a big jump in the antibody, and that is what will be sustained for the possibly the whole life of the child.
Right. So when you talk about boosters and vaccines, what about the flu vaccine? The flu vaccine is taken on a yearly basis, if I'm not mistaken.
Right, yes.
So how does that work? And does a flu vaccine need a booster?
Yeah, that's a different thing. The flu vaccine now is because it is the flu virus is such a virus that it actually mutates and it changes every year. It changes, so it's so it's so flexible that every year there are few times the WHO has to call meetings within certain regions to discuss which serotype they need to do for the next year. So that's the reason why the flu vaccine has to be given on a yearly basis.
Right. No, I do understand that even doctors are going out there and questioning the greater role of social media companies in combating misinformation, and that there's a lot of misinformation going out there. Like earlier on, you talked about social media and how things are being exaggerated on social media. So within your social media page or the social media page of your clinic or the hospital, what kind of feelers are you putting out there in order to connect and engage with these people?
Okay, we've got like the website www.ifl.my. We put in information about vaccine preventable diseases. We put in information about vaccines. We put in information from parents whose children have got the infection. We put in an interview with a polio victim, a person who's got polio, and they're all in a form of stories. So we're not putting hard facts because people get turned away from hard facts, and we also know that the attention span of the generation now, Gen Y, and the attention span is very short. So you have to get the information across within the first 3 minutes or so. And if that sustains their interest, then they will go further. But if you cannot sustain the interest, so it has to be very well choreographed and very well worked out, so that people and that's the thing that we do. As well as when there is a crisis, when there's a death from diphtheria, say, or when there are a lot of cases of measles, then we put out information about measles vaccines, we put out information about diphtheria.
Right. Now, I think the other question is about the government, and if the government's doing enough in raising awareness on the importance of vaccines or immunization.
Yeah. I think the government is doing a lot. It's got, they've got the number of vaccines that we have in the country exceeds the rest of all our neighbors within this region. In fact, a lot of countries in the world, and that's a credit to the government. And at the same time, as I said earlier, Immunized for Life is also partly involving the Ministry of Health. So they are trying to put out information. They're also trying to teach their own people about immunization, and they are getting data on people who are refusing. Now, if you have if you come to a clinic, kesihatan, right, the health clinic, and you tell them that you don't want to have vaccine, then they will refer you to a doctor, and then and these things are all documented. So the Ministry of Health is doing quite a fair bit. The only thing they have stopped at is making vaccines mandatory.
Right.
That's a controversial issue, and that was spoken.
in your opinion, do you think that should be done? Vaccine should be made mandatory.
We have reached a point where we need to consider that seriously, because we got smallpox under control when it was actually mandatory. It was an offence not to get the smallpox inoculation, and at that time you had a scar, so you'd have to get. I mean, I was born before that period, before the 1980s, so I had a scar.
You're giving away your age.
Yeah. So
but having said that, the halal issue is also being played up, because in a country which is an Islamic country, or the main religion of this country is Islam, I think a lot of people sort of play on the halal issue here. You know, how are you dealing with this as a specialist?
I can assure you that the Ministry of Health is very concerned about this halal issue, and for every vaccine that they approve, they actually have resort to looking at how the vaccine is manufactured. They don't actually have to have a halal certificate there, because once we have a halal certificate, then we're classifying them as halal vaccine, non-halal vaccine. There should be no such thing.
Right.
And as far as if there is some porcine material within the vaccine, the Ministry of Health is quite open in stating that there is porcine material made within in the process of the manufacture.
Right. Dato, I think we've gleaned off enough information from you until we meet you again and get more information out of you. You know, we'd like to thank you for taking time off your busy schedule for joining us right here on Medical Today. We're going to take a short break and come back. We'd like to thank Dr. Zulkifli Ismail, consultant pediatrician and pediatric cardiologist from KPJ Selangor Specialist Hospital. Stay with us. This is Medical Today on BNC. Hello and welcome back to Medical Today. This is episode 6, season 3.0. I'm Jared Ratnam. Now, to talk about our eyesight, you know, all of us have eye problems, and when it starts to blur out, we tend to panic. And we have Dr. Norazlina Bachik, a specialist from KPJ Pusat Pakar Mata, or Center for Sight. Today we're going to talk about eye problems. We're going to be talking about refractive and anterior segment surgery, and anything and everything to do with or whatever else we can cover right here on the show. Doctor, thank you very much for taking time off to be with us. It's a pleasure to have you here. Now, I guess with the eyes, the first place to start with is blindness in Malaysia. You know, do you have any stats with regards to blindness in our country?
Yeah, thank you. With regards to blindness in Malaysia, you know, we have this ongoing national eye surveys actually, and the latest actually reported about 39% of the population, which comes to about 216,000 of our population is down with either bad visual impairment or blindness. And the most common cause of this blindness is actually cataract. You know, to be living in this sort of, you know, advanced era, it is still very sad to see that, you know, majority of our population still end up with very bad or severely visual impairment, despite the availability of advancement in the medical treatment, and namely the ophthalmology treatment. The next common cause is, of course, the diabetic retinopathy, which is a complication of the eye, secondary to poorly controlled diabetes. Now, you know, Malaysia, we are a multiracial country. You have a lot of holidays, you have a lot of celebrations, you have the Hari Raya, you have the Deepavali, you have the Christmas, you know, and food is basically one of the most, of the biggest contributor to this year. We don't really actually notice that blood sugar is piling up in the body because you don't go for the medical checkup. So it's very important that you take at least once a year to go and have your full medical checkup, and a lot of times people tend to forget the eye.
Right.
You do everything from head to toe, but the eyes are not done.
No, but I guess the other question is when you say diabetic retinopathy, so I guess everyone's thinking, well, I'll wait till I get diabetes and then I'll go check my eyes. So can it even happen when you're in the pre-diabetic stage?
You see, when you say you're a diabetic, it's only when you're diagnosed to be a diabetic. How long before that diagnosis have you been a diabetic? God knows, because you have never gone for your checkup. You see, you may have been harboring that particular disease for a few years down the line before you become symptomatic. Even for people who are symptomatic, they don't even bother to go for to get their blood sugars checked. You see, so by the time you get diagnosed, it would have been a few years down the line. And if you have to know that in the body you will have two organs which harbor or has the smallest caliber of blood vessels. You know, it's basically diabetes is a disease which affects all these blood vessels, and the smallest will get affected first. And what are the organs? Is the eye and the kidneys. See, the only thing is that the eyes and the kidneys, they differ in the sense that although both come in a pair, you have the right and the left eye, you've got the left and the right kidney, but the reservoir of kidneys is actually quite high. You can have one kidney totally non-functioning and a half-functioning kidney, then only you become symptomatic. Whereas in the eyes, it depends on the part of the retina. That is the wiring system of the eye. Which part of the retina gets affected first? If the focusing point gets affected first, you will be symptomatic and you will realize that, you know, your vision is started to blur up and you will go for examination. But if the changes happen around or other than the focusing point, you will not know what's happening there until it can be quite severe and maybe like, you know, you have bleeding in the eye and things like that.
I guess the next thing I want to talk about is refractive errors. We need to understand the word refractive first, but over and above that, you're an ophthalmologist and a refractive surgeon, which, so your area of speciality, if you could simplify that for us, what would that be?
It's basically, you know, when you talk about ophthalmologist, is an eye doctor. The other name is eye surgeon, you know. We are basically surgeon. It's a surgical field. So we do treatment, medical treatment for the eye in terms of giving, you know, medications, you know, things like conjunctivitis and things like that. We do also stitch up the eyes in case you got into trauma and, you know, lacerations in the eyes and things like that. And we also basically monitor the health of the eye, whether it be medical or even surgical. So refractive means that I have this special interest in looking at the treatment for refractive problem. Means what? Well, in the Bahasa Malaysia, we'll call it rabun. Things to do with the inability of your eye to see clear without the help of glasses or other methods.
So now that we know a little bit about what refractive problems are, or rabun as we say in Bahasa Malaysia, now what are the types of refractive errors are out there, or have you come across as a specialist?
There are basically 4 types of refractive error. Yeah, you're born with either one of these. Number one is you're normal, nothing of the refractive errors, or you can be short-sighted. In the medical terms, we call it myopia. In Bahasa Malaysia, we call it rabun jauh. You see, English and Bahasa Malaysia is terbalik. English and Bahasa Malaysia is the reverse. So is the short-sightedness means your rabun jauh, means far distance vision is blurred, whereas near you're okay. Now, the other thing is the reverse of that, which is the far-sightedness. Far-sightedness means your far distance vision is good, only that you have a little bit of difficulty reading. So you see children, when they go to school, they have difficulty when doing their homework, you know, copying things and things like that. They may be having far-sightedness. Together with this, either short-sightedness or far-sightedness, you can have astigmatism. What astigmatism does is that it allows you to see, but it smudges things up. You know, it's like when you write with a wet tip pen and then you sort of squeeze it, and then you have that. You can see the A, but it's all smudgy. So that's what astigmatism does. And
or if you're driving at night and car beam lights up ahead, they look like sunlight to you.
Yes, it's like Hari Raya every day, right? So the other thing is that after a certain age, which is you normally at the age of 40, now you start to have this reading problem, you know? How do we know when you have this? Now, for people who have always been a short-sighted person, you'll find that when you put your glasses on for full correction, you will need to raise it up. So you see all these people going around reading with the glasses on the forehead.
So like for me, I've got a lens that's of course progressive.
Bifocal,
bifocal lenses. So when I first found out I couldn't read, I needed to bring it further than my usual distance.
Yes.
Why is that?
That is because the lens in the eye is becoming old. It is an aging process actually. It's similar to, you know, you're
not
getting...
good news at all, seriously.
No. It's similar to the hair growing grey, so the same thing is happening in the eye. Whereas where the lens is becoming older, it becomes less elastic, it loses its ability to focus near.
So what can surgery do to help with this? You know, everyone's saying, pergilah surgery, bagus, very good for you.
Surgery would
don't have to wear glasses.
Yeah, it depends on what surgery you're talking about. So maybe we will talk about how do we treat refractive error first, to understand how we can get around.
So
this
we know
problem.
there are 4 types of refractive errors. Okay. And now how do we repair this?
Okay. Number 1, the old time-tested glasses, of course. That can treat up to, you know, thousands of power if you want. The only thing is that when the power gets too high, the glasses become stick. And it's very cumbersome, very uncomfortable for people to wear. Of course, you don't wear the glasses, you know, you're, well, basically practically as blind as a bat. So you do need to go on that one. Now, people don't like glasses, they can go on contact lenses. But of course, you know, sorry to say, but although it is a viable option there, but I'm not a big fan of contact lenses.
You're not why?
No ophthalmologist, you know, is a fan of contact lenses simply because if you, number 1, if you don't really know how to take care of contact lens, you're going to end up with a lot of problems.
So caring for it is one of the bigger problems.
Yes. You know, well, we do still find, you know, shops selling contact lenses without prior explanation or advice to people, to their customers on how to care. They just, okay, what do you want? I give you this, you buy this, you buy that, and this is the latest and whatever not. You go home and with no advice whatsoever. You know, so these people are going to go home thinking that is the best and the most convenient way of treating their refractive errors, but you do have people ending up with problems, you know, from the as trivial as something like allergic reaction to either the solution or even to the protein deposits you can get in the contact lens.
I mean, I guess at the end of it, it is about hygiene, and you know,
definitely, it's all about
you're using
hygiene.
your fingers all the time, and sometimes you forget to wash your hands before dealing with the lenses.
Especially in the morning when you're rushing to go to work, you know, and if you keep these solutions and the contact lens cases in the bathroom, now in the toilet, you know, where you have all your WCs, everything there. So every time you flush the WC, everything, all the dirt goes up in air, and it will get sedimented on the casing, and you forget one day, you know, everything in a rush, you just plump it on and then off you go. That is when trouble will happen. You know, a lot of people say, no, doc, I've been on it for 20 years and nothing happens. Yeah, you know, you've been so lucky. I always tell my patients that you have been lucky. If you have been, like, you know, symptom-free or problem-free, I doubt if it's symptom-free or problem-free, because you will definitely have a little bit, at least a dry eyes problem. You know, dry eye is very rampant. Very common in contact lens wearers. Simply because,
but here's the other problem about dry eyes, and I guess this is something where we're digressing to, but I'd really like to talk about this simply because a lot of people are going out there and getting their own eye drops. You know, they don't know what the problem is, but you just walk into a pharmacy and there's a whole kaleidoscope of eye drops that you can obtain, and you know, they're saying get this for these kind of dry eyes, but if you need it to glisten, then take this. I guess that's sort of a bad habit because it's not coming from a doctor.
Well, we're not going to get into an major argument here.
That's a major argument.
We are not going to cross anybody's line here, but being a doctor, I have to advise this. No offense to anyone, but you correctly what you have just said, you have to know what treatment you're getting for what problem you're having. If you don't know what problem you're having, how can you just, get the correct treatment for it, no? Symptoms can vary. It's similar like headache. It can be stress related, it can be hunger, it can be whatever, lack of sleep, too much work, all those things, but it's headache. So what, even tumors can cause headache. So what is it that we are treating, Similarly in the eyes. Dryness. A lot of people see dryness. Dryness can be caused by a lot of causes. To the simple fact that you're always outdoors, exposed to the environment, to this air-conditioned environment, a prolonged work on the PC. When you concentrate on your PC work, you don't actually blink that much, and you have this aircon going on, to keep you comfortable, but it's never good for the eyes. So all these things need to be looked into. Some other systemic problems also, medications that you take, like for example certain antihypertensives can also cause dryness. So if you're not treating this accordingly, the problem will not go away. No offense to the over-the-counter prescriptions, but going by the symptoms alone is not enough.
Right. Now going back to refractive procedures, what are the types that you have problem with when you're fixing them? I mean, there's four refractive problems.
Yeah.
Okay, when you fix these procedures, or when you carry out these procedures, sometimes there can be some disadvantages to it and advantages to it. What are the disadvantages and advantages?
You're talking about the surgical?
Surgical,
yeah. Basically, before we even conduct, or before we even decide whether you're suitable or not, we do have to conduct certain assessments. Number one, the first and foremost important thing is your age.
Right.
Nothing surgical gets done for people below the age of 18. That's international guideline, because normally the refractive error would stabilize around that age, about 18 minimum. Maybe some people a little bit slower, maybe up to 20 years old, but nothing below that. Because why? The children are still growing, so the refractive error is still fluctuating, you see. So refractive surgery is done on something which is very stable. So you need to have a stable prescription or refractive error before we can even do that. Now, number two thing we need to see is whether are you normal? Are the eyes normal? Meaning you must not have any form of eye diseases, cataract, dry eyes, if it's not so severe, it's okay. If it's severe, we need to treat all this first.
So you need to assess the suitability.
Definitely. No, I mean, not everyone comes through the door gets done, full stop, well, I have turned down so many others. If you're not suitable, if you're a diabetic, for example, you have a cataract, if the eye pressure is not normal, if the nerve looks unhealthy for whatever reason, diabetes or any trauma with the scars and things like that, we don't know. So this is, although a very viable option, but it is, in the world, the insurance companies still lump this under cosmetic surgery, because you do have, other options. Like
so refractive procedures come under cosmetic surgery?
Yeah, they don't cover. So you cannot use your medical insurance to cover for this treatment. You got to be out of your own pocket, contact lens and glasses. But of course, if the degree is actually quite high, you may not be comfortable wearing glasses or even the contact lenses. So it becomes therapeutic. Even if it becomes therapeutic, nobody will want to cover that. The third most important thing is that we need to assess the refractive degree, the refractive error degree, and the cornea thickness that you have. Because refractive surgery is a surgery that is done on the cornea alone, only the cornea. Nothing of the inside of the eyeball is being touched. So it's a very safe procedure, because we're dealing only on the surface of the eye. Well, if you want to put it very simply, that anything can go wrong, but things will still recover,
Right. So as you undergo a procedure, of course, you need time to rest and come and get back to normal. How long does it take for a person to recover from a procedure?
Now, it depends on the type of procedure that you get done. Basically, I'm going to tell you 3 different major groups of refractive surgery. Number 1 is what we call the advanced surface ablation, in which the skin of the cornea gets debrided, and then laser will be applied to it, where it will resculpt or recontour the cornea, and that's basically what refractive surgery is all about, to reshape the cornea. Yeah. Now, once the surface is debrided, laser will be applied, and later we will have to put on the bandage contact lens. It's much like the normal soft contact lens that you have, but we will leave it for about a week in the eye, for the skin to regrow healthily. That will, so invariably you see that you need a 1 week off work if you're working, and 1 week off, classes if you're studying. That takes a little bit of time there. Now, the next procedure is the one with a flap, where a very thin flap is cut, much like when you cut the milk tin,
right?
And the kedai mamak kan, you open
it's
it up,
like
and then you
opening
leave
up
a
tin.
hinge there, and then you lift that flap up, you laser, and then you put back that hinge. So that will take a lot less time to heal, because not much of disturbance on the surface. More comfortable compared to the first procedure, and you can actually go back to work even the next day. Well, it depends on how workaholic you are. Some people get it done on the same day and go back to office immediately. Very little discomfort there.
But you've also heard of stories where people who've done procedures after a while have to go back to wearing glasses.
Yeah, it depends on how you take care of the eyes, actually. Basically, now in in our world now, the use of gadgets is really maximum.
Right.
If
gadget all the time, or one
gadget all
to
the
the
time.
other, yeah.
In the office is the computer, and then next when you present is also again all these gadgets, and then when you go home, not even home, maybe in your free time is always the handphones, and right up to the last minute before you close your eyes, the handphone is on all the time. So it's like the engine of a car. If you don't manage it, you don't maintain it well, you don't rest it well, one day it will just break down. So the same thing goes to the eyes. If you keep on forcing these eyes to work, it will just go into this condition of fatigue, and that is how you get back a little bit of power there.
Right. They're now saying that there are many exercises that you can do to reverse refractive problems. Is that possible?
Well, number 1, like short-sightedness, most of the time is genetic. Yeah. Number 2 is nowadays you see a lot of young children getting it at a much younger age, as we compared to like 20 years back. We see all like university students or working adults and things like that. Now you're getting like 4-5 years of age with 600 refractive error. It's too high. Again, the gadgets, yeah. So the exercises is actually just to relax the eyes a little bit. But if you relax 5 minutes, but you're gonna push the poor eyes to work like 23 hours and 50 minutes through the day, and nothing will work. None of your exercises will work. Yeah.
Right.
These exercises is just actually to give a little bit of comfort.
Now, in my list here, there's a procedure known as the relaxed smile procedure. Can you tell us a little bit about that?
That was the third one I was going to talk about. Now, from the surface ablation, you get to the flap thingy. Now, this flap procedure is called the LASIK. Refractive surgery is generally known as the LASIK. It's actually, LASIK, it just means this one, the cutting of the flap. It can be cut 2 ways. One is with a blade, microblade. The other one is using laser. So it's all laser. Laser to cut the flap and laser to laser off the refractive error. 2 different types of lasers there. Now, the third and the latest technique is called the relaxed smile. Either the surgeon relaxes, the patient smiles later, or the vice versa. It works both ways. Now, what it means is that the refractive lenticular extraction, meaning one laser is used, which is a femtosecond laser. It's used to laser directly into the tissue of the cornea, and this will create a lenticule or a thin flap. a thin tissue, the thickness of which will depend on your power, how much power we want to treat, and that particular thin flap will need to be removed from the eye via a very small incision on the surface of the cornea. Normally the tissue goes at 4 millimeter. You can go down right up to 2 millimeter. It's a very tiny, basically a scratch on the surface of the cornea. So we remove that out and voila, it's done. So in terms of recovery, definitely, I mean, logically thinking, with a tiny scratch there, it will heal in no time. So that is the gentlest procedure actually, and the latest. Recovery is very fast, very little post-operative issues that you need to address, including dry eyes. The only thing is that, of course, again, hygiene. Post-operative, whatever it is, surgical hygiene is number one. Dirty hands, no, there's a no touching the eyes, and then you got to be a bit careful. Infection, once infection sets in, it's going to be very difficult to treat. So again, whatever it is all hygiene.
Now, when we look at it, I guess to end the interview, the best thing to do would be your go-to advice with regards to eye health. The things that we do every day that we shouldn't be doing.
Sometimes doctors are also guilty of doing all this. Number one thing I think is stay healthy. You gotta eat healthily. You gotta do your exercises. Keep healthy. Never get any of these diseases, namely hypertension, diabetes and things, because invariably, in one way or another, it will affect the eyes. Let age alone, because there's nothing much that we can do about age. People say age gracefully, but we have to do our bit to keep healthy, to keep all this system working as it should. And gadgets. If there are two things that I have to mention, it has to be, one is your health, and number two is the use of gadgets. Very difficult to actually
but achievable.
Yes, you can actually. But I always tell my patients, work can wait. Even if you're not a doctor dealing with emergency situations where people can die if you don't respond fast. 5 minutes, 10 minutes, half an hour late in responding, what is there? Or sometimes you can even actually wait till the next day. You don't even need to do anything during the night. So nighttime, after dinner, everything off.
Right.
Not even handphones at the dinner table, nothing.
So we'll take that as advice before we close. Two things: keep yourself very healthy, or keep yourself as healthy as possible. And number two, stay away from gadgets. I think this is the best advice I've gotten so far, which is to stop using your gadgets just after dinner. I think a little advice that we can all pick slowly and try to follow through as much as possible. On that note, we'd like to thank Dr. Norazlina Bachik, a consultant ophthalmologist and a refractive surgeon from KPJ Center of Sight. On that note, we'll take a short break and come back with more for you right here on Medical Today. Hello and welcome back to Medical Today with me, Jared Ratnam. In the final segment, we take a look at nosebleeds. A lot of us suffer from nosebleeds, but some of us kind of do the wrong thing when it comes to nosebleeds. So most of us tilt our head backwards with the nosebleed, and apparently that's not the way forward. Now we have a video for you. It's called First Aid Mistakes, a little something we're doing in season 3. Let's take a look at first aid mistakes. Of course, today we're taking a look at nosebleeds and about what you should do when you have a nosebleed. Let's take a look at this.
The mistake is tilting your head back during a nosebleed. This can cause the blood to drain into the back of your throat, which can make you gag or cough, potentially obstructing breathing. Do this instead. Lean forward and apply direct pressure by pinching the bridge of your nose. Keep your head in a neutral position with your chin parallel to the ground. Sit and stay relaxed. There are some situations whereby nosebleed can be caused by an underlying health issue, in which case you need to seek advice from a medical professional.
So now you know that when you have a nosebleed, the thing to not do is to tilt your head backwards, simply because the blood's going to drain backwards into your throat, and sometimes that's going to make you gag. Now, the thing you need to remember about nosebleed is if it's going to go on continuously for 10 minutes, you have to seek medical emergency straight away. You need to call 999 as soon as you can. So be careful. Now, with nosebleeds, as suggested by that video, what you need to do is tilt forward. I think that would be the simplest thing to do, which is to tilt yourself forward. Never put your head backwards when there is a nosebleed you're dealing with. But if you're in doubt, call 999 first. And if you don't know what to do, they'll probably talk you through what to do in a situation. On that note, if you do have any questions for us, you'd like to send us a question, or you'd like to send us a request for someone to be on the show, please send it to our email address, which is ask@medicaltoday.my. That's ask@medicaltoday.my, and we'll be more than happy to do what we can to help see through your request or your suggestion. On that note, don't forget, in episode 7, we will be speaking to Dr. Ng Tek Siang, an ENT surgeon subspecializing in otology and neuro-otology. What's all that? If you don't know what that is, join us then when we speak to Dr. Ng to find out about non-cancerous ENT disorders right here on Medical Today, only on BNC. On that note, I'm Jared Ratnam signing off. You have a fantastic weekend, and we'll see you next week. Bye-bye.